Sure, I'm Zane Burke, CEO of Livongo Healthcare, and we're an applied health signals company that works on chronic condition management. So starting first with diabetes management, hypertension, weight management, and behavioral. And how do we take the health signals off people's body and help people live their healthiest life in their workflow? So it's a combination of clinical piece along with consumer behavioral, and we put that together to really create a better experience and better financial and clinical outcomes for our members. Well, so if you look at the world today, everything has really been put together for a hospital setting. And really, as we see the future, how do you create something around the consumer themselves? So how do we really think about a great healthcare experience, one that creates a great clinical outcome and a great financial outcome? And so that's what we're trying to think about, is how we use digital along with the, so whether it's how do we take the signals off your body and apply those back to you such that you get the best clinical outcomes? How do we learn more about you, create motivations, and personalize those interactions with you? And then at the end of the day, when you need that person on the other end of the phone to be there, that clinician is there at that time that you need it, and when you kind of decided to interact into the system. So I look at digital as really changing the paradigm of healthcare and really flipping it from being a hospital-centric, centric and physician-centric kind of setting to a, how do I live my life? How do I get into a person-centric setting? Well, we start with the person in mind and think about how do we create ecosystems that allows people to live their life as healthy as possible, and then create all the other things around it to be integrated such that they can have an easy experience. We really need to truly make it easier to have these chronic conditions. And unfortunately, what happens today is most people get sent off with a booklet to learn about whatever chronic condition they have, and they're sent to go work on that chronic condition by themselves in isolation. And then they report back into their general practitioner or their physician, once or twice a year and see how they're doing. And that's not really gonna have an effective outcome. We've got to create, by design, systems that capture the information 100% of the time and allow and help the person to live their best life. So give them little nudges along the way to remind them how to be proactively engaged in their healthcare and feel like they have a coach along the way versus they're on their own and on an island. And so I think really having this person thought process in mind and creating a whole ecosystem around it is really an important driver, and I think it's going to also be kind of the differentiator between having a great healthcare experience and an okay healthcare experience.